press conference.
Not hearing anything, Philip. I can see the lady speaking.
Officer Dr. Shara and Professor Ian Cummins, who is from Public Health England, and we're here this morning to share with you some updates on our COVID-19 vaccine. So I'm supposed to put my mask on?
No, we put our mask on. We do.
When you speak English,
Yeah, that's what. When you're talking, take it.
Where's their mic?
I don't know. Oh, they don't have
1, 2.
mics.
they have a appointment. There'll be appointments.
Is there something I need to do here? No voice coming from you guys. Come on,
Good
guys,
morning
say
and welcome
something.
to the Ministry of Health and Social Services press conference this morning. We are here to brief the press as well as you, the public,
That just
on
to
our
test all.
COVID-19
Jeez, on my
vaccination
way.
program, the current state of affairs, as well as to introduce to
You're
you,
muted,
our
Philip.
viewers, Professor Ian Cummins from Public Health England. So thank you for tuning in. Thank you
Oh,
to the
for
various
heaven's
media
sakes,
houses
Philip,
for
I'm
being
not
on
hearing
this
anything.
morning. And thank you for tuning in via GIU, that's the Government Information Unit, Channel 96 on the Digicel Network, and via the YouTube page. As I mentioned, we are here to discuss our COVID-19 vaccination program. It would have begun back in February, and so we're a couple months in, and we're going to provide an update as to where we are with that. I'm going to provide a short introduction of the two guests here with us this
Philip, I'm
morning.
not hearing
To
anything,
my
man.
immediate left, I
Huh?
have Dr. Shara Greenway-Drury.
I'm not-
She's no stranger to
No,
us.
I'm
She is
not
our
hearing that. I've been
Chief
trying to
Medical
tell you that.
Officer, serving
No, you're
ably
muted,
for the
Bobby.
past 3 years, and before that, since 2011, she was our Medical Officer within the Ministry of Health and Social Services. To the far end of the table, I have Professor Ian Cummins, and just so that we can all get a little bit familiar with him, I'm going to share a short biography about his professional expertise. So Professor Cummins, he started his career in the NHS, that's the National Health Service, working in coagulation disorders before moving into healthcare management career in 1990. He has held a variety of general management posts, including over 11 years as Chief Executive of Large Hospital Trust, 3 years as the Chief Executive of an NHS Healthcare Commission organization, and 3 years as the Chief Executive of the NHS in the West Midlands region. In parallel with his NHS career, Ian has a long history of working with the education sector, including as the NHS lead for establishing Lancaster University Medical School and developing and running leadership and management development programs for clinicians. From 2006 to 2012, Ian was the Vice Chair of PMETB, the then UK Postgraduate Medical Training Regulator. He has extensive experience in major incident leadership and management, having led at either tactical or strategic level the response to a large number of incidents, including several multiple trauma incidents. The UK's largest ever outbreak of Legionnaire's disease in 2002, the flu pandemic in the West Midlands in 2009, and the Birmingham riots in 2010. Professor Cummins was also the NHS lead for the response to the Mid-Staffordshire NHS Trust Quality of Care scandal from 2010 to 2012. From 2012 to 2020, he was appointed as the first Chief Executive of Health Education of England, the largest education and training organization in the world, responsible for a $5 billion budget and for overseeing the education, training, and development of the current and future NHS workforce. In 2017, at the request of the Secretary of State for Health, he established within HEE a new unit, NHS Global, to focus on global healthcare, workforce, and global relationships with the NHS. Through NHS Global, he led work on behalf of the UK government in many countries, including India, Uganda, Thailand, China, Indonesia, Middle East, El Salvador, Mexico, South Africa, Indonesia, and St. Vincent and the Grenadines. In 2020, after 25 years as a NHS chief executive, he moved into a portfolio career, being appointed as the UK Ambassador for Health to the overseas territories, as the first professor of global healthcare at Keele University, and also as chairman of the West Midlands Ambulance Service. For much of 2020, Ian worked in Gibraltar and the Turks and Caicos Islands on their COVID response. He was awarded the OBE for services to the NHS in 2003, and in 2010, he was made an honorary fellow of the Royal College of General Practitioners. Professor Cumming also has been recognized with honorary degrees from 5 universities and has held honorary or visiting professional roles at the universities of Cape Town, Pavia, Italy, Lancaster, where he has taught on a range of healthcare leadership programs. He also has an interest in sports and exercise medicine, an area in which he holds a Master of Science degree. He's a qualified level 3 swimming coach, a keen snow skier, and enjoys sailing and hill walking. So we now know a little bit more about Professor Cumming, and we're very pleased to have him here with us in Montserrat. I will now hand you over to our Chief Medical Officer, and she will give us a few brief remarks, and she will be followed by Professor Cumming.
Thank you, Penny, and good day all, and happy Workers' Appreciation Day to all as well. And I'm just going to give just a brief overview of the program, as well as just a little background with the relationship between Montserrat and Public Health England. So with the advent of COVID-19, the government of Montserrat has implemented a number of measures to protect the population. These measures include ramping up our Port Health obligations, developing and implementing protocols for management of the different elements involved with COVID-19, increasing our capacity to test and treat patients with the addition of PCR and other equipment, all with the help of the UK government and other partners such as Public Health England, which I will now refer to as PHE. Montserrat has a long-standing relationship with Public Health England, PHE. They have been offering technical assistance to Montserrat for many, many years, so long before COVID, especially in the areas of vector-borne diseases, international health regulations, hospital laboratory improvement, and disaster management and preparedness, just to mention a few. When COVID-19 appeared, the support continued, and words cannot express the immense gratitude that the team in Montserrat has for the vast number of technicians in PHE that would have assisted us over the last 18 months or so. They have assisted us with developing protocols, procuring equipment, just like the PCR machine that I mentioned before, and of course with the COVID-19 vaccine. So we're happy to have 2 members here on the island with us to assist us with a number of things, such as educating persons with the vaccine itself, and also to do some more work with the Glendon Hospital Laboratory. And Professor Cumming will go into more detail about the public engagement and other activities that he has on island with us. The COVID-19 vaccine is another element that will assist us in the fight against this novel virus. The vaccination campaign in Montserrat began in early February 2021, as Ms. Maloney had mentioned. Montserrat received 5,000 doses of the AstraZeneca COVID-19 vaccine from the UK government, and we are immensely grateful for this. To date, 1,344 persons have received their first dose of the vaccine, and 1,106 persons have received their second dose. The number of persons receiving their second dose equates to 33% of the eligible population and 24.5% of the general population. Therefore, to date, only 24.5% of the general population has been fully vaccinated against COVID-19. Once all 1,344 persons have received their second dose, then that will only be 39% of the eligible population, which equates to 29.7% of the general population. I would like to remind persons that vaccination is instrumental in our fight against COVID-19 in combination with other measures that have been implemented, such as quarantine and testing, etc. The goal is to vaccinate as close to 100% of the eligible population as possible. That is 3,442 persons. This equates to 76% of the general population, and this would put us closer to attaining what is called herd immunity. Importation of COVID-19 into Montserrat will be a threat for some time, and attaining a high level of immunity in the community is the surest way to offer protection to the persons who are not eligible for the vaccine. It will also be the key to our borders. This vaccine lowers your risk of contracting severe COVID-19 infection, lowers your risk of death, and lowers the risk of you passing the infection to someone else. Vaccines in general are safe. This vaccine has been proven to be safe and effective against COVID-19 and the variants of concern. So I'm encouraging persons to think about it, discuss it with your family and friends, and make a decision that will offer the best protection for you, your family members, and the general population. And I'll end there and hand over to Ian.
Thank you, everybody, and good morning, and happy Workers' Appreciation Day. Before I start with a few comments about COVID and the vaccination programme, can I just express my grateful thanks to the warmth of welcome that myself and my colleague Dr. Newton have received here in Montserrat. I was actually here more or less exactly 28 years ago on my honeymoon. So although it's very different and very different circumstances, it's really nice to be back, and thank you again for the warmth of welcome. So, as you've heard, I've been working with the team from Public Health England on the response to COVID, particularly in the overseas territories, and also more recently working specifically on the vaccination programme. And I think some of what's been achieved here in Montserrat is truly remarkable. If you think back to only 18 months ago, there were and what was available in terms of laboratory testing then compared to the capacity and capability you have got now that's been developed in this really is remarkable. You have got some state-of-the-art testing facilities here now with people actually able to save lives and to deliver tests that would just have been unheard of. And that's been achieved through a tremendous amount of hard work by everybody here in Montserrat. And if we've been able to help that in a small way, then we're very pleased to have done so. But I wanted to particularly talk about the COVID vaccination programme, and I wanted to use Gibraltar as an example. So I've been working in Gibraltar for much of the last 6 months or so, and when I got to Gibraltar in January, they were just starting in what has turned out to be the worst phase of COVID for people in Gibraltar. The virus had got into the older people's nursing and residential home sector, and it was just rampaging through the nursing homes, and people who were fit, well and healthy one day were simply dying a matter of only days later. And I can only describe it as an absolute tragedy. And this is in a country that a matter of only weeks earlier thought that they had no problem, thought that they had this under control, thought that the outbreaks of COVID that they'd seen had been relatively small and relatively well contained. And then all of a sudden, the virus got to older people in society and just devastated so many lives. So what we have now with the COVID vaccine is an opportunity to really try and protect people. And I know a number of young people would say, well, I'm not at risk from the virus. If I get it, I'll recover. Well, yes, that's possibly true for younger people in society. But do you know what? You might pass it on to somebody else. You might pass it on to grandparents. You might pass it on to people with underlying conditions who are vulnerable. So if you don't want to be vaccinated to protect your own health, then I'd encourage people to think about being vaccinated to protect older and more vulnerable people in society here in Montserrat. Vaccination is all about risk. There is a risk associated with taking the vaccine. There's a risk associated with taking an aspirin or a paracetamol. There's a risk associated with crossing the road or having an influenza vaccine or a tetanus vaccine. But it's all about how do we risk. So for somebody in their mid-50s, you are 200 times more likely to die from COVID than you are to die from having the vaccine. 200 times more likely to die from COVID than you are to die from having the vaccine. If you're in your 20s, then those figures are slightly different, but you're still between 2 and 4 times more likely to die from COVID than you are to die from having the vaccine. So the vaccine is safer than getting COVID, and that's the real message that I'd like to leave with you today. Think about older people if you've decided that you don't need the vaccine because you're young and fit and healthy and would shrug it off. That may be true, but the more the virus spreads, the more mutations we'll see, and the more likely it is to get to older or vulnerable people. And think about the risk. Yes, there's a small risk with the vaccine. There's a much greater risk if you get COVID. We want to see Montserrat open again. We want to see more people able to visit this beautiful island. We want people here to be able to travel more freely. We want places to return to normal. The best way to do that is by people getting vaccinated so that you are protected and that your population is protected. Thank you.
Thank you, Professor Cummins. So we have had our remarks from our CMO and from Professor Cummins, and we will now turn our attention over to the media to allow for questions. We do have some in the room, and we also have one person, I believe, tuning in via Skype. We're going to start at the furthest end of the table. I know that you all have a lot of burning questions. However, be mindful to stay on the topic at hand this morning, and keep your questions concise so that we can have enough time to have them answered sufficiently and so that everyone can have a chance to have their questions heard. So we'll start on the furthest end of the table. We can take 2 per person, and then we'll go back around if needs be. So we'll start with you. You are Aliaguana Express, and we'll end with Mr. Roach tuning in via Skype. Yes, and you can ask 2 questions each, and if needs be, we'll make another circle around the room.
Good morning. I'm Malika McKenzie from Aliaguana Express, and my question is for Dr. Shara, our CMO. How many health professionals, particularly nurses and doctors, have taken the vaccine, and how important is it for health professionals to take the vaccine in light of the high vaccination hesitancy?
Okay, thank you. So unfortunately, I don't have the data for that as yet. We're still trying to collate all of the information and then give the breakdown in statistics. But it is important for health workers to be vaccinated simply because it not only protects them, but it also protects the patients that they're looking after. So we are encouraging it. Ian is going to have a session with health workers as well to address any hesitancy that may be among the group, but also health workers are leaders. So once they are leading in the front in terms of being vaccinated, we're hoping that would encourage other persons to come forward for a vaccine.
And for my second question, and I know that, there are some level of public concerns about a perceived high number of deaths on island, some unexpected, and where some of the deceased may have been vaccinated with the COVID-19 vaccine. While the government has made an inquiry into these deaths, there is still a high level of distrust with the findings. Why should the people or / the public trust these findings?
Okay. Well, to be fair, the authority that should be addressing these concerns would be the health authority. So that is the Ministry of Health and Social Services. So every suspicious death, and I wouldn't even call the death suspicious like that. They are termed sudden deaths. And with sudden deaths, it's difficult sometimes to determine the cause. And so you have various levels of investigations that we would implement. And one level is bringing in the pathologist to perform a postmortem to better determine the cause of death. And that's what happened in these cases. So based on the medical history and any symptoms or signs that they would have been displaying before they died, there has been no link associated with the vaccine. That was confirmed when the pathologist did the postmortem on the individuals that we requested for. So, not quite sure why there is a level of mistrust for the authority that should be reporting on cause of death. If you're not part of the Ministry of Health, I'm not quite sure what authority persons may have to be reporting on the cause of death. I don't know if that answers your question or it helps. I don't know if Ian wants to add something to that as well.
Perhaps if I just add a little. Now, obviously, I can't comment with regard to Montserrat because I've not been involved in any of those investigations, but I can comment with regard to the hundreds of millions of people now that have received COVID vaccination around the world. And we have a system that reports through to the Medicines and Healthcare Regulatory Authority in the UK. It's a yellow card system, so that if healthcare professionals or indeed individuals themselves have any symptoms or any side effects as a result of the vaccination, then they're reported through to a central database where a big analysis is undertaken to actually look at whether or not there's anything coming out from the actual vaccine themselves. And that's how some of the issues with the very small number of people that had developed blood clots associated with the vaccine were actually identified, was coming out through this. But what we can say, going back to the comments that I made earlier, is that the vaccine globally is safer than having COVID. You are less likely to die from having the vaccine, much less likely to die from having the vaccine COVID. And I think that's the really important thing to remember. There is no medical treatment or intervention that is 100% safe. You know, if you have an anesthetic, there is a risk with the surgery, but you know lower than the risk of infection and the risk of you dying than if we didn't operate on you to remove your appendix. This is exactly the same. It's putting a